A very good morning to my dear students. So today we look into dental anatomy and we'll deal with the permanent mandibular molar. Now I have divided this session for you into three. Now the first session we'll concentrate on the buccal and the lingual aspect of your permanent mandibular first molar. The second session I'll take you through your mesial, distal and occlusal aspect of your first molar. And the third session you will concentrate on the second and your third molars. Before we go into details about each teeth or about this particular tooth, we'll have a look at the general features. Now this tooth is considered to be the largest as well as the strongest tooth inside your oral cavity. And when you look at the teeth as a whole, it has got 5 cusps and it has got 2 roots. Among the five cusps, the 3 cusps are present on the buccal aspect. So that is your mesiobuccal, distal buccal and your distal cusp. And the other 2, that is mesiolingual and your distolingual, is present lingually. It has 2 roots that is positioned towards the mesial and the distal part. So you have a mesial root and a distal root. And when you look at the dimension or the size of the crown, it is wider mesiodistally than buccolingually. So mesiodistally, it is going to have a greater dimension when compared to your buccolingual dimension. We'll move on to the chronology part of it. The first point of evidence or the first evidence of calcification or the point of calcification you will see when the child is born. So at birth you can visualize calcification as soon as the child is born. And following the birth, the enamel takes around 2.5 to 3 years for its completion. And this tooth will erupt into your oral cavity at the age of 6 to 7 years. So this is your first permanent tooth to erupt into your oral cavity, that is at the age of 6 or to 7 years. And as we all know, following your eruption, it takes around 2 or 3 years for the root completion to happen. So the root completion happens between 9 to 10 years of age. Now we'll discuss on the individual aspects of the tooth. So we have to cover 5 aspects. Now before we start with each aspect, remember whenever you write your answer, you will have to discuss each aspect under the following heading. So firstly, you have to divide your tooth into a crown part and your root part. Under the crown, you will discuss the shape of the crown that you see from the aspects. What are the different landmarks which you see on the crown portion or on the buccal portion? Okay, that includes your cuspal tips, the cuspal outlines, inclines, shape of the cusp, size of the cusp, and then the other features like your groove or your pit. And then once you describe the features that you see, you describe the surface anatomy, whether it is convex, concave, whether any depressions are present. And then you proceed on to the outlines of your aspects. So that will, if you look at from this aspect, you have your mesial outline and the distal outline, or you can have your buccal or the lingual outline. So you will describe the outlines. How is the outline shaped, whether it's convex, concave, and where is your crest of curvature or your contact area. So along with your crest of, along with the description of your outline, you have to talk about the crest of curvature. After that, you have to discuss on your cervical ridge that you see or the cervical line that you see. And then you proceed on to the discussion of your roots. So in the root, if it is, you have to write whether it's multi-rooted or single-rooted. And then if it is multi-rooted, you have to describe about the root trunk part of it and its distance from your cervical line. How much is the width of your root trunk from the cervical line? And then individually, you have to describe the root. What is the shape of the root? Then the outlines of the root. So each root will have a mesial or a distal outline or a buccal or lingual outline. So each outline you have to describe. How is the shape of the outline? Then you have to talk about the tip of the root, whether it's pointed or whether it's sharp, and how is it positioned, whether it's deviated mesially or whether it's deviated distally. You have to talk about the root. So this is what generally you have to discuss when you talk about each aspects. Now we'll move on to the buccal aspect. Now, if you look at the shape of the crown, it is trapezoidal. So, the shape of the crown is trapezoidal. And from this surface, how many cusps can you see? You can see 5 cusps. So you can see 3 cusps on the buccal aspect and also some portion of your lingual cusp. So basically all the 5 cusps is seen from your buccal aspect. Now we'll go individually into each cusp. So major cusp that you see on the buccal aspect is your mesiobuccal, your distobuccal and your distal cusp. Now among these 3 cusps, the largest cusp that you have here or the widest cusp that you have here is your mesiobuccal cusp, which is wider mesiodistally. So the width or the length or the width of the cusp is mesiodistally. So it's wider mesiodistally. Then other than that, if you observe, you have to look at the cuspal slopes or the cuspal inclines. Now when you look at the cuspal ridge of your mesiobuccal cusp, it is flat. You see the surface, it is flat. Compare this ridge with your ridge of your lingual cusp. See, it has cuspal slopes or it has cuspal inclines. So your lingual cusp, if you see, has got cuspal slopes and cuspal inclines. But if you see the cusp here, it is, the cuspal ridge is flat. Then you move on to the next cusp, that is your distobuccal cusp, which is almost the same width as your mesiobuccal cusp. So it is slightly smaller but almost the same. And if you look at the cuspal ridge, see the curvature? This is more curved when compared to your mesiobuccal cusp. Now this is flatter, this is more rounded. And the last cusp that you can see a majority of the portion of your distal cusp. This is the smallest cusp that you can see. It's more distally placed. So it is actually placed between your buccal and your distal corners. So it is positioned towards a corner. But when you visualize from the buccal aspect, you can see the major part of your smallest cusp, that is your distal cusp. Then when you observe the cuspal ridge, you compare between all the 3 cuspal ridge, this is more rounded. See the curvature, it is more rounded. So if you take the cuspal ridge of all the 3, this is almost flat, this is slightly more curved and this is more rounded. Then other than your cusp, you can see some grooves here. So from the buccal aspect, you can see 2 grooves. The first groove, this groove here, you call it as a mesiobuccal developmental groove. So this is the developmental groove which divides your developmental lobes. So this is your mesiobuccal developmental groove and this is your distobuccal developmental groove. We'll go into the mesiobuccal. The mesiobuccal developmental groove is present between your mesiobuccal cusp and your distobuccal cusp. And this groove, that is the distobuccal, is present between the distobuccal cusp and your distal cusp. Now, when you take the length of each groove, your mesiobuccal groove is shorter and it ends exactly in the mid-line or mid-point when it runs cervico-occlusally. So when you take it cervically to the occlusal aspect, this groove runs exactly or ends in the middle portion. And it will end into a buccal pit. So you have a small depression here at the terminating part of your buccal groove, which is your buccal pit. So this groove will always end in your buccal pit. When you take the other groove, that is your distobuccal groove, this is actually longer than your mesiobuccal groove and it ends near your distobuccal line angle. So it actually ends near to the corner of your distal outline and it usually terminates in the cervical third. So this is at the middle third. This terminates at the cervical third. So these are the features that you see on the surface of your buccal aspect. You have your cusp, 3 cusp which is visible, and then you have 2 grooves and the termination of the grooves you learned. Next, what we see here is your cervical line. So your cervical line, if you see, it is very regular. It is curved also. So it's a regularly curved line. And when you look at the curvature, it's a gentle curvature which is dipping apically. The dip is towards the apical region exactly in the bifurcation area. So this is your bifurcation area and the dip is exactly in the bifurcation area. So basically it's a regular line which is slightly curved and this curvature, this dip part of your curvature is in the bifurcation area. Then when you examine the tooth as a whole, if you run your hand and see over the surface, this tooth is actually very smooth except at the cuspal area. Now when you feel your fingers here, you can see the convexity of, or you can feel the convexity of your cusp. And this part when you run, it is slightly depressed and it appears very, very smooth for you. Now other than your cusp, your groove and your smoothness of the surface, you have a small depression here towards the end portions of your groove, especially in your middle third portion. So if you run your fingers here, you can feel a small depressed area which is running mesiodistally. Now this is your developmental depression. And even below your cervical line, that is over the bifurcation area, also you can feel a concavity or you can feel your developmental depression. So basically this depression can continue over to your bifurcation area and then that depression will join with your furcation. Next aspect which we are going to cover is your outline. So we covered with all the surface features or the landmarks on the crown portion. Next we'll cover with the mesial outline and your distal outline. So whenever you talk about the outline, you always talk about the shape of the outline. Now if you observe this outline, this is convex till your contact area. Now this point which is marked here is your contact area. So till the contact area it is convex, and then from your contact area to your cervical line it is slightly concave. Okay. Then when you take your distal outline is convex till your contact area and then it is straight till your cervical line. So the difference between the outline is convex and concave on the mesial outline. This is convex and it is straight from your contact area. And when you take the contact area on your mesial outline, it is actually present exactly at the junction of your occlusal and middle third. So it is present in the middle portion, that is at the junction of your occlusal third and your middle third. That is your contact area. We'll move on to the root part, or how your root appears from your buccal side. Now, when you see, as I've told you, you have to talk about the trunk part of the root and individually both the roots. Now, your bifurcation area here, this is your root trunk. If you see, it is almost 3 millimeter from your cervical line. So this bifurcation which is present here is approximately 3 millimeter from the cervical line. So you have a 3 millimeter width here. And then we'll move on to each roots individually. So you have two roots. One is your mesial root and the other one is your distal root. Now, when you look at the mesial root, you see this looks more curved than your distal root. We'll go into outline. So this is curved than your distal root. And we'll go into the outline of each. So you have a mesial outline here and you have a distal outline. Your mesial outline, if you see, okay, it is curved till the middle portion. So till halfway it is curved and then it tapers distally. See, from here it is going to run or it is going to taper towards the distal side. And the maximum crest of curvature or the convexity that you have here, this is actually when you draw a line from here, it is present away from your crown or mesiobuccal crown outline. So this portion that you have here, the crest, is actually positioned away or outside your mesiobuccal crown outline. Then when you look at the distal outline, see, it is more concave. So your distal outline is concave. Your mesial outline curves till your midway and then it tapers distally. Now, looking at the distal root, it looks much more longer than your mesial root. It looks more straighter than your mesial root, or it is actually less curved. And if you look at the direction of the root is directed more towards your distal side. So it has got a distal tilt. And the apex you see here is more pointed than your mesial apex or mesial root apex, and it is present distal to your distal contact area. This is your distal contact area at a greater height here. And the distal contact area, if you draw a line, your root apex is placed even more distally or outside your distal contact area. Now, when you take the root, it is wider buccally. So the root has got more width on the buccal side. And other than that, you can see developmental depression. See, if you see nearer to your furcation area, see this part. It has got depressions or concavities on the surface. Now, this helps in a better anchorage of the tooth or the root into your alveolar bone or your socket. We'll move on to the next aspect, that is the lingual aspect. Here again, when you look at the aspects of the features on the lingual side, you have two main cusps. So major, you can see two major cusps, that is your mesiolingual cusp and your distolingual cusp. This is mesiolingual, this is distolingual cusp. And along with these two, you can see a very small portion of your distal cusp. But in your buccal aspect, you tend to see a wider portion of your distal cusp. But here you tend to see only a small portion of your distal cusp. Now, see the difference between your, compare the difference between your cuspal ridges or the slopes on your buccal aspect and on your lingual aspect. Now, if you see here, these cusps have got slopes, or the cuspal ridges are placed at an angle towards each other. They are more pointed and more sharper. And this is your mesiolingual cusp. It is wider and the tip of the cusp is much more higher than your distolingual cusp. So if you see here or if you look here, the tip of this cusp is placed at a much greater height than your distolingual cusp. And if you see the cuspal slopes, they are placed at an angle. So the cuspal ridges or the cuspal slopes are placed at an angle towards each other and the angle is more obtuse. Now if you see, the distolingual cuspal ridge has got a greater obtuse angle than your mesiolingual cuspal ridges. Now your distal cusp is much more shorter than these two cusps. Other than the cusp, you can see your developmental groove. Basically, this groove that you see here, that is your lingual developmental groove, which is present between your mesiolingual cusp and your distolingual cusp. Then when you examine the surface of the tooth, it is more smooth and it is kind of rounded or it is spheroidal. Your cervical line, compared with the buccal aspect, there it was regular curve. And here if you see, it is irregular. So whatever line you have here is very irregular, and when it has got a wavy appearance, and the sharpest point or the sharpest dip that you see is actually at the bifurcation area. So this dipping that you see is a sharp dip which is nearer towards your bifurcation area. Then we'll go on to each outline, your mesial outline and your distal outline. Now, mesial outline is completely convex from your cervical line to your marginal ridge. So from here, from the cervical line to the marginal ridge part, it is convex. And your crest of curvature here is actually much higher than your distal aspect or distal outline. So the convexity or the maximum crest of curvature is placed at a height, or it is placed at a higher level when you compare with your distal aspect or distal outline. Now if you look here itself, the tooth is tilting towards a distal aspect. It's got a tilt towards a distal aspect. So obviously this contact area is going to be placed at a higher level than your distal portion. Then we talk about the distal outline. It is going to be straight above the cervical line till your contact area. So this will be your contact area and then it is convex. So this is similar to what we studied on the buccal aspect. Even your buccal aspect, the distal outline was convex and then straight. And your mesial outline, there was a difference there. It was convex and it was concave. Here it is convex throughout. So that's a difference between the outlines on the mesial aspect and on the lingual aspect. Now, when you look at the roots from the lingual aspect, it is more slender. It is more, it looks very thinner than your roots from the buccal aspect, and it is more longer. See, if you see here, it looks much more longer than your buccal aspect, and it is almost 1 mm longer than the appearance of the root from the buccal aspect. Now, if you compare the bifurcation area, the distance or the length of your root trunk here, it is 4 millimeters. So it is much more wider here. By 1 millimeter, it is more wider when compared to your buccal root trunk area. So there it was 3. On the lingual aspect, the root trunk, the distance is going to be from your cervical line to the furcation area. The distance is going to be much more greater, that is 4 millimeter. Thank you, and I'll continue with the mesial and distal and occlusal outline in the next session or the next video.